You just found out you're pregnant and you're wondering what to expect from your first prenatal appointment. In this video, we're going to talk about why this appointment is so important, but also what to expect, and we're going to go through it from beginning to end. I want to start with an overview on why this appointment is so important. A mentor of mine used to always tell me that everything in obstetrics happens in time and space. What's normal at 10 weeks in pregnancy is not normal at 20 weeks, which is not normal at 30 weeks. So establishing a due date is very important. The other really important part of this appointment is to get a baseline history. However you come into pregnancy, it kind of changes the expectation of what we can offer and what we can't offer. So when we're going into your first appointment, it's really important that we get to know you personally, how you are as a person, what your interests are, what you're expecting out of your prenatal care, but also to find out, do you have any medical issues that are coming into the pregnancy, so we can talk about how to best serve you and have a positive, happy experience, but also a safe one. So the first thing that normally happens is you show up to the office and you go to the counter, and it's really important to remember your insurance card, but also your ID, so we identify you appropriately. You then are sitting in the waiting room, and a medical assistant usually calls you into the room. Once you're in the room, they usually have you change, and then a provider comes into the room. The first important thing that happens is we take your medical history. We want to know if you have any medical issues, like if you have hypertension, we need to know if we need to start you on any medication, diabetes, if you have any thyroid issues, because those things change in pregnancy. For example, your blood pressure in pregnancy tends to dip in the first half and increase in the second half. For example, your thyroid, you tend to need more thyroid medication in pregnancy, so getting these baselines done is very important. The next thing we ask you is your surgeries. Surgeries is important because, especially if you had anything in your abdomen, because we want to know what we can offer you as far as delivery. If you've had surgery on your uterus, for example, a myomectomy where they remove your fibroids, a vaginal delivery may not be the best option. Versus if you had other medical issues like Crohn's and had any bowel surgery, it's important to know, as far as if surgery is necessary, how that would affect your surgical planning. Other important things are, for example, if you had bariatric surgery, you may get some vitamin deficiencies, and that's really important to know beforehand, so when we get to the lab section, we know to order the correct things for you. From then, we want to go through your allergies. Some medications you cannot give in pregnancy, and what we're able to offer you is more limited. So ideally, before you're pregnant, we have a lot of patients, for example, that tell us they have a penicillin allergy, but they have no idea how or why, and their grandmother, for example, just told them when they were younger. So verifying your allergies before pregnancy is actually super helpful. We then go through your social history. We want to know, are you in a relationship? What your living situation is? What's your socioeconomic situation? We also want to know what you do for work. Some jobs have different lifestyle exposures than others. Obviously, if you're sitting at a desk all day, we want to make sure you're getting up and walking around so you don't get any clots in your legs. It also helps us know who you are as a person and what your values are, so we figure out how we can best serve you as far as experience-wise in the pregnancy. For example, some people are more holistic. They want more of a physiological birth coming into this, where some people value more their time and structure, and they like to have things planned out. So trying to figure that out now is very important. The next thing we go through is your gynecological history, and this is one of the most important things as far as dating a pregnancy, because we want to know how long your cycle length is. Because when we do the dating ultrasound after, what we do is we assume a 28-day cycle, and we establish a due date, and we compare it to the ultrasound. Most people don't have a 28-day cycle. So if you're someone, for example, if you come in at 7 weeks, but you have a 40-day cycle, it would not be surprising for us to see a 5-week pregnancy. And at that time, we may not hear a heartbeat because it has not formed yet. So it really comes into counseling, because as you may realize coming into this, especially if it's your first pregnancy, that a lot of people get very nervous or are very excited, and there's a lot of emotions coming into it. And if I tell you there's no heartbeat but everything looks normal, you usually don't hear the second part of that sentence if we don't counsel you appropriately beforehand. We then ask you if you've had any pregnancies beforehand, including miscarriages, abortions, if you've had any vaginal deliveries, C-sections, etc. And that way we have a complete history to go into the next section. We then do a brief physical exam. If you are overdue on a pap smear, we may do one now. and then we move forward to the ultrasound. So the ultrasound is either going to be done transabdominally, like over your belly, or transvaginally, which is a vaginal ultrasound. If normally we do this appointment somewhere between 7 and 9 weeks, because that's old enough that we expect to see a heartbeat and enough to reassure you. One of our very common questions that we get asked is, we got our phone call at 4 weeks pregnant, and people ask us, can I come and be seen the next day? And the answer is we can't, because we don't expect to see anything yet. When you're doing an ultrasound, for example, at 7 weeks, we may need to do a vaginal ultrasound because the probe has to be closer to the pregnancy to be able to see something. Usually around 8 weeks, if the baby's about 1 centimeter in size, which is maybe the size of your fingertip, it's very small and may require us to use a probe that becomes closer to the pregnancy. From there, the due date is established. Hopefully we get some nice pictures. This is one of my favorite parts of obstetrics, is showing people their baby for their first time. Not all practices do their own ultrasounds, and they may send you out, but again, this comes into what is expected in the first part of the pregnancy. After the ultrasound is performed, we usually tell you how the practice works. We line out what happens for the next appointments, and we usually open the floor for questions. Strong recommendation is to write down your questions beforehand, because a lot of times the confirmation ultrasound is very emotional and you may forget to ask what you've been thinking about for the last 3 to 4 weeks. The very common questions that are asked are, can I dye my hair? What can I do? Can I exercise? What can I eat? And what prenatal vitamins should I take? So I would take the time beforehand to figure out what questions you have and then ask them. Once all the questions are asked, we usually bring you over to the lab, and from there we sign consents, and we sign 3 consents. The first consent is NICA, which is a consent for neurological disorders from pregnancy. Every doctor in the United States contributes to this fund. The other one is for HIV, because we test you twice in the pregnancy, and the third is carrier screening. And carrier screening, I think, is very, very important, and we'll definitely make another video on it. But generally, ideally, if we can do it before pregnancy, it would be ideal, but the idea behind the carrier screening is we test you and your partner for your genes. You have 2 sets of genes, one from your mom and one from your dad. And you have something called a dominant gene and a recessive gene. A dominant gene is what it sounds like. It's the one that takes over, it's the one that's expressed. So there's a gene, for example, called cystic fibrosis. If you have 1 copy of the gene, you're fine. But if you're a carrier for that, and your partner is a carrier for that, there's a 1 in 4 chance that the baby can have that condition. So we would like to ideally know that before pregnancy, but if not, we would like to do that now to know if more testing has to be done later in pregnancy. The other labs that we test you for is we test you for a bunch of sexually transmitted diseases. We test you, like I said previously, for HIV. We test you for syphilis. We test you for chlamydia, gonorrhea. We also test you for viral titers, which is hepatitis B. We test you for hepatitis C, rubella, and varicella. We also test every pregnant person on their first appointment for a urine culture, because even though you may not have signs of an infection, you're at a higher risk for a urine infection in pregnancy. Other things we may test you for now are specific labs that may pertain to your specific medical issue. For example, like I talked about before, if you have thyroid disease, we will test your thyroid levels at this time. If you have higher risk for preeclampsia or hypertension, we're going to get a baseline labs checking your platelets and your kidneys and your liver to make sure everything's okay. In our practice, we send people out to a high-risk doctor for the nuchal translucency scan and the anatomy scan, which are done around 12 and 18 to 20 weeks. And we again reiterate to you when your next appointments are. We'll definitely make another video going through what to expect when in pregnancy. From there, you check out and you make your next appointment. I hope you found this video helpful, and we'll see you in the next one.